I think there has to be additional mental health screening, particularly for mothers of multiples, twins, triplets, and higher order, particularly when the statistics show that the likelihood of PNDA in these communities is so high.
There is an identified gap in the healthcare needs of supporting parents of multiples. So greater awareness from health professionals to identify the specific challenges that families may face after discharge from having multiple babies. It's really important to provide that ongoing follow-up and referral and information around existing supports and resources that may be helpful for that family. My name is Danya McStein. I'm a psychologist and working as a clinical team manager at Gidget Foundation Australia. We have over 175 clinicians delivering online and in-person psychological therapy to families all across Australia. Gidget Foundation Australia provides education and training to health practitioners to increase awareness and recognition of the signs and symptoms of perinatal mental health concerns. So we have the Gidget Training Institute, where practitioners can go online and complete modules informing them around perinatal mental health that can then assist them to be able to identify when parents are struggling and to provide that early intervention that we know produces the best outcomes for wellbeing. Parents of multiples are already considered at higher risk. This may mean greater medical appointments, more monitoring, testing, and a lot of worry and anxiety around the birth and about the baby's health. We also know that multiple babies are more likely to be born prematurely, so this may warrant longer hospital stays or stays inside the neonatal intensive care unit. This can be very traumatic and stressful for parents, and so services, because there's only 3% of babies that are born that are multiples. They're a lot smaller population, and services are not necessarily set up to be able to provide the specific support that they need to help them through their health and mental health challenges after the birth. So there's a considerable gap in terms of the knowledge of healthcare providers about how to support discharge planning and the financial pressures that go with being multiple family, and also the health needs of both the babies and the mother postpartum.
My name is Maddison, and I'm a 32-year-old mother of twins who were born at 31 weeks and 4 days gestation and spent 52 days in NICU and special care across 2 separate hospitals, the first of which was over an hour from my home and which I travelled to daily via car for 4 weeks before they transferred closer to home. The girls were discharged just short of their due date, and that was when my perinatal mental health challenges really began. I was very lucky to have my husband and my in-laws to support me and to look after my girls while I did telehealth appointments with Gidget Foundation to address the challenges that I was facing. But the trauma of an early birth and the complications from that were the starting point for my mental health challenges.
We know that 1 in 5 new mums and 1 in 10 dads can experience perinatal depression and anxiety. Parents of multiples are also at increased risk of mental health challenges due to the specific needs of caring for multiple babies. So we know that 68% of parents of multiple babies experienced greater stress, anxiety and depression, and roughly 3/4 of those said that they experienced greater isolation and loneliness. There are a number of reasons that parents of twins, triplets and more may experience increased challenges postpartum. This can be due to the health complications both for the mother and also for the babies, particularly if they were born prenatally. There are greater financial costs. The parents need 2 or more of everything, double prams, extra car seats, and more medical costs. There are increased relationship stresses on the family due to the caregiving burden of looking after multiple children. Sleep can be significantly affected with babies waking up at different times in the night and having different needs. Many parents of multiples also report greater problems with breastfeeding, so it can be much more challenging feeding two babies and trying to establish breastfeeding and sleep and wake routines. If there are older siblings in the household as well, we've got parents trying to care for multiple children and feeling stretched and overwhelmed at trying to meet the needs of all of these kids as well as the new babies. So there's a lot of challenges that can affect parents, particularly of multiples, in that early postpartum period.
As part of the standard antenatal care, I was subject to a mental health screening, flagged for anxiety, and was provided pamphlets, but that was the extent of it. There was no further screening. After I had a severe postpartum hemorrhage, which landed me in an operating theatre, I woke up in recovery, and all the focus was on my physical recovery. I had a wonderful midwife at the hospital she did ask me how I was going, but again, her focus was on my physical recovery and getting me expressing milk and the like. I did have another mother in the NICU who was my source of support on the occasions that we bumped into one another. But no social worker, no support. I was very lucky. My community and family health nurse, when we came home, was switched on and I could talk to her, and she did the screening and flagged me for PNDA.
We know that peer support is really important, particularly to connect with other parents of multiples who have an understanding of the unique challenges and joys that can become with being a parent of multiple children. So we do encourage that parents try to find an opportunity to connect with other parents of multiples, whether that might be online groups, online forums, attending group programs wherever possible, or reaching out to family and friends just to get that peer support. We also know that where somebody is experiencing any mental health challenges, professional support is essential. So whether that might be to attend an online group or access in-person individual support at one of our Gidget houses, or the Start Talking telehealth program, which can provide a clinician available to provide psychological therapy anywhere in Australia. The key here is to find somebody that you trust, that will listen, that will help support you with your particular needs, perhaps help navigate care with other services, but just to reach out and get that support so that you don't feel so alone when you're struggling with caring for small children.
I think there has to be additional mental health screening, particularly for mothers of multiples, twins, triplets, and higher order, particularly when the statistics show that the likelihood of PNDA in these communities is so high. Just in general, for any family, there should be additional mental health checks. The focus is so much on physical recovery, and that makes sense, but mental health is so critical, particularly for new parents. I thought I knew what I was getting myself into, but until you know, you don't. Gidget Foundation was phenomenal. I was matched with a counsellor and she has been my lifeline. I'm only just discharged from her. I was so lucky that my family health nurse and my social worker were able to put me in touch as early as they did. I wish more people knew about Gidget Foundation.
There is an identified gap in the healthcare needs of supporting parents of multiples. So greater awareness from health professionals to identify the specific challenges that families may face after discharge from having multiple babies. It's really important to provide that ongoing follow-up and referral and information around existing supports and resources that may be helpful for that family. So any practitioners who are engaging with that family, particularly in the postpartum period, should be looking for signs of potential mental health challenges. For example, changes in mood, greater tearfulness, irritability, loss of joy in the usual things, or perhaps challenges with bonding with the baby. If they do notice any of these signs, it's important to speak with the family and encourage them to link in with services that can provide them with that support.